Hi guys, today's our topic is cardiac cycle. So what is cardiac cycle? Cardiac cycle is nothing but it is the cyclical events that occur in one beat. So let us think that there are 72 beats per minute in 60 seconds. So one beat will be occupying 60 by 72 which is around 0.8. So one beat will be occupying 0.8 seconds. So the duration of each cardiac cycle is 0.8 seconds. So what is cardiac cycle is nothing but sequence of events that occur during a beat. So there are two contractile units, atria and ventricles. So events occur simultaneously and separately both in atria and ventricles. Let us see first what are the atrial events. So if we say contraction of the atria, we call that as atrial systole, and relaxation we are calling that as atrial diastole. So we have atrial events, atrial systole and atrial diastole. And if you see here, atrial systole is 0.1 second and atrial diastole is around 0.7 seconds. And after the atrial systole, the ventricular event that occurs is ventricular systole. So that occupies around 0.3 seconds and ventricular diastole will be occupying around 0.5 seconds. So if you see here, atrial systole and ventricular systole are not occurring simultaneously. The reason for that is AV nodal delay, which is around 0.1 seconds. That is why this ventricular systole is following 0.1 seconds after the atrial systole. These are the primary events of the cardiac cycle: atrial systole, atrial diastole, ventricular systole, ventricular diastole. But we don't talk about atrial diastole separately because that is overlapped with ventricular systole and ventricular diastole events. So atrial events, atrial systole which is 0.1 seconds and atrial diastole which is nearer to 0.7 seconds. And ventricular events, in ventricular systole there are two phases: isometric contraction and ejection. Ejection is again rapid and slow. Isometric contraction, the name itself says, iso means same, metric length, or we can say isovolumetric. So the volume of the ventricle remains constant, but it undergoes contraction in a closed chamber. That means AV valves are closed, semilunar valves are closed, and it is contracting in a closed chamber. The purpose is to increase the pressure tremendously. Once the pressure in the ventricle is more than the aorta, simply the blood ejects out. That is ejection period. So 0.05 seconds is the isometric contraction, 0.22 seconds is the ejection period, and total of 0.27 seconds. Then ventricular diastole, which is around 0.5 seconds, and it has one. Okay, now the ventricle contracted and ejected the blood out. Now it has to come back to its original shape. That is called as protodiastole, 0.04 seconds. Then after coming back, it has to relax so that its pressure should be less than the atria. So ventricle has to lower its pressure so that blood flows from the ventricle, from the atria to the ventricle. So that is called as isometric relaxation, 0.908 seconds. Once the pressure in the ventricle is lower, AV valves open, the blood rushes from the atria to the ventricle. That is called as rapid filling. Once the pressure difference is lowered, there occurs the next phase, that is slow filling. Now the pressure gradient is almost nil. Now atria kicks with one stroke, that is atrial systole, that is called as last rapid filling, which is 0.11 second, which is nothing but the same as this atrial systole. So these are the events that occur in the cardiac cycle. Now before going to individual phase, we'll summarize the changes. First we'll go with the atrial pressure changes, then ventricular pressure changes, then ventricular volume changes, then heart sounds, then ECG. These are the 5 entities we will talk in every cycle. in every phase of the cardiac cycle. Now, intra-atrial pressure, okay. Now, if you see here, the phases are mentioned here. Atrial systole followed by isometric contraction and ejection of ventricular systole and ventricular diastole, again atrial systole. We are not talking about atrial diastole events, it is just a relaxation phase. Okay, now, whenever the atria contracts, so whenever the atria contracts, definitely if a chamber is contracting, pressure increases. So we'll get a wave called as A wave, and this A for atrial contraction or atrial systole. Okay, now after the atrial systole, the following event is atrial diastole. Similarly, the following event in the ventricle is ventricular systole. Now isometric contraction is occurring. So as the isometric contraction is occurring, the valve cusps of atria, this tricuspid valves will bulge into the atria. So valve cusps are bulging into the atria. So that causes lessening of the volume of the atria and pressure increases as some foreign body, like not foreign body, some as the valve cusps bulged into the atria will be having the pressure increased. So C wave is due to cusps of tricuspid valve which bulges into the atria. Now, once the ejection is done, now the blood is rushed out of the ventricle outside into the aorta or pulmonary artery. Now the cusp which bulged also comes out. So we'll get the pressure lowered. That is called as X descent, and we call that as relaxation phase because that occurs in the atrial diastole. So X for relaxation. Now the next phase is, now the atria is getting filled up because it is undergoing relaxation and it is getting venous return. So it is getting filled up. So the pressure is slowly increasing. So we call that V as venous return. So the pressure has increased. Now once the atria has accumulated the blood, now it has to release that blood into the ventricle. So whenever the atrioventricular valves are open, the blood is gushing into the ventricles. So intra-atrial pressure is reduced, and we call that as Y descent, nothing but emptying, and then followed by atrial systole. So these are the phases. I'll make it again. So atrial systole, increase in pressure, so A wave, and then bulging of the cusps gives you C wave, and then we'll get X descent due to the relaxation and also due to the ejection phase, and then venous return due to the inflow of blood into the atria, then rapid filling and slow filling where the blood is emptied, so Y descent. So A, C and V are the positive waves, X and Y are the negative waves, or what I can say, decreased waves. Okay, so that's the intra-atrial pressure changes. This is nothing but the jugular venous pulse tracing. Jugular venous pulse will be directly connected to the right atrium. So whatever the atrial pressure changes can be identified with the jugular venous pulse tracing. Now intraventricular pressure changes. So what happens with the atrial systole? Blood is ejected into the ventricle. So some volume is added, pressure rises. So atrial systole, we got the pressure raised. Now after that we got isometric contraction. The purpose of isometric contraction itself is to increase the pressure tremendously within a short period, and the volume of the chamber remains constant. So if you see here, the pressure increases tremendously within a short duration. Now ejection period, still the ventricle is contracting. So as the ventricle is contracting, pressure is still raised. So occurs the rapid filling, then rapid emptying, then the slow emptying. Again the pressure falls, but the fall is not beyond the initial rise. Now protodiastole, ventricle is relaxing. So pressure falls. Now isometric relaxation. The pressure falls tremendously within a short duration and the volume of the chamber remains constant. So pressure decreased. Then filling phase. Even though ventricle is filling, the pressure is falling because the ventricle is accommodating that volume. So this accommodation of the new added volume will cause no much change in the pressure till the pressure falls. And then the last rapid filling, which is nothing but atrial systole, again the same segment. So rise in pressure. These are the intraventricular pressure changes. Now coming to the intraventricular volume changes. Okay. Atrial systole. Definitely blood is added into the ventricle, so volume increases. And then isometric contraction. Volume remains constant. Then ejection phase. So blood is ejected from the ventricle. Ventricle is shortening. So volume decreases. Then protodiastole. Nothing much change in the volume. Then isometric relaxation. Almost similar. No much change in the volume. Then rapid filling. Now the volume increases. Slow filling. Again last rapid filling are nothing but the atrial systole. So these are the phases that occur during intraventricular volume changes that occur during the cardiac cycle. Now coming to the heart sounds. We know the first heart sound is due to closure of AV valves. So closure of AV valves occurs during isometric contraction. So first heart sound will occur isometric contraction period and also a part of ejection. And the second heart sound usually diastole. So diastole first phase is protodiastole as well as isometric relaxation. So third occurs during rapid filling. Fourth occurs during atrial systole, or we can say last rapid filling. So these are the 4 heart sounds which occur during cardiac cycle. And coming to the waves, if we say here the P wave, atrial systole, QRS, ventricular systole, and T wave, ventricular diastole. And atrial diastole is overlapped by these waves, so atrial diastole is not seen separately. Okay, P wave corresponds to atrial systole and QRS corresponds to ventricular systole and T wave corresponds to ventricular diastole. Now we will mention each phase. Atrial systole, duration is 0.11 second. Which wave of JVP? A wave. So A wave in JVP. So A wave is a positive wave, so intra-atrial pressure increases. And this pumps 10% of blood into the ventricles. And intraventricular volume as well as pressure both increases. And in ECG it corresponds with P wave. And what heart sound it comes? It gives fourth heart sound. So fourth heart sound is given by atrial systole. Now ventricular systole, first one is isometric contraction and it is around 0.05 seconds. It causes C wave in JVP. So C wave is also a positive wave, so intra-atrial pressure increases. Intraventricular volume remains constant because isometric, the name itself says. Pressure, the purpose is to increase the pressure, so pressure increases. And we already mentioned corresponds with the QRS complex in ECG. And isometric contraction is concerned with first heart sound because closure of AV valves occur here. Ejection phase 0.22 seconds and rapid ejection 0.13 and slow ejection 0.9, because in rapid ejection the pressure gradient is more. That's why more blood is emptied into the aorta. But in slow ejection the pressure gradient is reduced, so ejection becomes slow. And as the blood is ejected, the cusp comes back into the ventricle, so atrial pressure decreases. So that causes X descent in JVP, which is a negative wave. So pressure decreases in the atrium. And coming to the intraventricular volume, simple, the blood is going out, so volume decreases. Intraventricular pressure, now the muscle is contracting, so definitely pressure increases and is corresponded with T wave in ECG. Of course, T wave is like at the juncture of this ejection and also the protodiastole. Ventricular diastole, first phase is protodiastole, nothing but the contracted ventricle will comes back. So it is 0.04 second, and this is during this phase venous return in intra-atrium is occurring. So atrial venous return is increased, means pressure in the atrium increases. So V is also a positive way. Intraventricular pressure definitely decreases because ventricle is relaxing, and protodiastole is the juncture where second heart sound comes because of closure of semilunar valves. Isometric relaxation. Now isometric, volume is constant, pressure decreases. It occurs 0.08 seconds, and intra-atrial pressure increases because venous return is still occurring in the atria. Intraventricular pressure decreases, volume remains constant, and rapid filling. Once the pressure in the ventricle is lower than the atria, blood comes faster into the ventricle. That is called as rapid filling, 0.11 second, and it contributes to 70% of the ventricular filling. And there occurs Y descent because the volume of the atrium is reduced, so that causes Y descent in the JVP, which is a negative wave. So pressure decreases in the atrium and ventricular volume increases. Simple, ventricle is filled, so ventricular volume is increased, but the pressure, there is no much change because it accommodates, the ventricular muscle accommodates and is responsible for the third heart sound. And slow filling phase. Slow filling phase contributes for 20% of the blood flow. As the pressure gradient between atria and ventricle is reduced, it becomes slow, and it takes around 0.19 seconds, and intra-atrial pressure still falls. So Y descent is still continuing. Intraventricular volume is increased because it is filled, and pressure, there is no much change, or I can say that still it falls because ventricle is still accommodating. Now 70% by rapid filling, 20% by slow filling, 10%. Again the same atrial systole or the last rapid filling occurs, which contributes to 10% of the filling. Okay, and that leads to again a wave in JVP, that is intra-atrial pressure increases. So this is the cardiac cycle. To summarize all these events, if you see here, atrial systole corresponds with the P wave and corresponds with the fourth heart sound, and the volume of the ventricle increases, pressure in the ventricle increases, and coming to the isometric contraction, QRS complex in ECG, and isometric contraction will cause first heart sound. If you see here, that is in both isometric contraction and ejection also. And coming to the ventricular volume, isometric means constant, and coming to the pressure, the purpose is to increase the pressure, so pressure increased. Ejection period. Ejection period, we have the T wave, and you can see here the volume has decreased because the blood is leaving the ventricle. The pressure is still increasing because the ventricle is still contracting. And coming to the protodiastole, we will be having the second heart sound here, and will be having still fall in the volume. Volume remains constant, but the pressure falls. Isovolumetric relaxation, pressure falls much, volume remains constant, and we have the ECG isoelectric line. And rapid filling, in the rapid filling we have the third heart sound. Now the volume is increasing. In slow filling also the volume is increasing, and then we have the pressure still falling because ventricle is accommodating the extra volume of blood that is coming in. So that's the cardiac cycle in a nutshell. And I didn't mention the JVP. So A wave in atrial systole, and C wave in isometric contraction and V wave in isometric relaxation. So these are the phases, and X descent in ejection and Y descent in emptying. So these are the phases of cardiac cycle. I think I made it clear. Thank you for your patient listening. Bye.